Shared decision making is really critical for patients, and it's been introduced into the clinical guidelines for the treatment of heart valve patients, which means patients have a clear voice in their treatment. And shared decision making can only happen if all stakeholders involved, and that includes clinicians and the whole heart team and patients. And having that discussion and having equal voice in that is really critical to the success and the implementation of shared decision making.
And for me, this is, particularly rewarding because on the heels of our meeting in Amsterdam, where we brought together 19 international experts, including patients, and I had the privilege of co-chairing this with my friend Sandra McGonigal, but also clinicians, researchers, policymakers, who all came together to look at what are the barriers and then what are the opportunities. Today was about those opportunities.
Shared decision making is so important for people diagnosed with heart valve disease because the intervention is really big. It's you have the right to understand and to decide what happens to your body, and it's crucial to be informed because it relieves you of anxiety and uncertainty, and is positive. This is that. Data shows that it is positive for the healing process as well.
Shared decision making, again, is important not only for patients and always on the other side, also for clinicians.
Bringing patients to equation of decision making will reinforce the multidisciplinary decision making of our team. It will benefit patient care, but also it gives more purpose and direction of where we are heading. So not only treating patients based on clinical outcomes, but also patient-centered care where we also consider patient-reported outcomes.
The roadmap, what we're doing here in the UK, Heart Valve Voice have brought together 10 patients to talk about their experiences when they were investigating what type of treatment they wanted. And what we'll do, we'll take actions from that into deliverables and tactics over the next year so that we can help empower the untreated patient.
From a patient's perspective, it is really, really exciting that this is happening. We met earlier on today with another kind of patient group, and there was many patients in the group like me. Yeah. Those patients that were really proactive, that sought out the information, were really driven, some going to different treatment centres from where they live. But the one thing from me was during that session, there was one girl there that was full of regrets. I don't know how many times she said, I wish I'd known. I wish I had done that. I wish. And I just think shared decision making needs to take the burden off the patient. Yeah. And hopefully going forward, it's great to see so many people interested. And I think going forward, that's what I would like to see. I would like to see the patient at the centre, and I would like the burden. And I don't want to hear any more patients saying, I wish I'd known, I wish I...
And I think that really puts that key outcome that we're trying to move the needle on, that idea of decisional regret and having a really good experience of care that we know is going to ultimately improve outcome.